Hello friends, I am Dr. Kiran Kumar. I am a nephrologist and kidney transplant physician at Continental Hospitals, Hyderabad. So today I am going to talk about hypertension or high BP and kidney disease. So I think we all know that a lot of people have high blood pressures. So high blood pressure in technical terms is called hypertension. So this hypertension, we think that because we are involved in high tension jobs, or we have a lot of stress in our lives, the BP goes up, and that is most commonly responsible for hypertension. Apart from this, there are several other causes that can cause hypertension. For example, any heart condition can cause hypertension, any kidney condition can cause hypertension, any thyroid issue can cause hypertension. So there are lots of other causes for hypertension other than stress in your life. So it's very important that you know the cause, you find out the cause for this hypertension and then treat it. So hypertension can be classified into two types. One is primary hypertension and another is secondary hypertension. So primary hypertension is usually most of the time the cause we don't know. Most of the times the cause is genetic. So hypertension is passed on from one generation to another, and we just give antihypertensives or BP medications to take care of this high BP. And secondary hypertension is a form of high BP wherein we know the cause. For example, any thyroid dysfunction, that is overworking of the thyroid, can cause hypertension, or any block in the blood vessel going to the kidneys, that's called renal artery stenosis. This can cause high BP. Then there are several other endocrine glands in the body which produce hormones. So these hormones are responsible for regulation of BP. So any abnormality in these hormones can cause high BP and hypertension. So these are all several causes of secondary hypertension. So any young patient coming with hypertension, we'll have to definitely rule out these secondary forms of hypertension. Or for that matter, any person who comes to us with very high BPs, or with a diagnosis of hypertension, we usually try to find out the cause of hypertension. So we run a battery of tests, including kidney function tests, heart function, ECG, 2D echo, thyroid function, and cholesterol levels. So we run a battery of tests and try to find out the cause of hypertension. So coming to hypertension in kidneys, so hypertension, if it is there for a very long time, that is more than 10 to 15 years, it can cause damage to the kidneys, and it can cause kidney failure as well. And it can also be the other way, that is when a patient has kidney failure, that can start off hypertension. So it can be either way. So hypertension for a very long time can cause damage to the kidneys, and kidney failure as such can cause new onset high BPs or hypertension. So we always have to find out the cause of this hypertension and kidney disease and then treat it. And there are several patients who come to us with BP fluctuations. So BP fluctuations are also a very important concept. So these patients tend to have underlying diseases like pheochromocytoma, which is a tumor of a hormone which is there in the stomach. Then there are other causes like renal artery stenosis. Then sometimes there can be stroke patients with so many BP fluctuations. So again, we'll have to go to the root cause of these BP fluctuations and then treat it. And coming to treatment of hypertension, there are so many medicines to control BP. So each patient will have a different profile. That is, if patient is having diabetes with hypertension, we use some medicines. Patient with heart attack with hypertension, we use some medicines. Some BP medicines cannot be used in patients with bronchial asthma. Some patients with the prostatic problems, they are given a different sort of antihypertensive. So not every patient will require the same antihypertensive. So in the society, most of the time people know this molecule called 1850 or 1825 or Stamlo or Amlong. So a lot of people know these names. They think that their relatives are taking these medicines and they'll also want to take the same medicine, but it's wrong. So if you have hypertension with kidney disease, it's always better to consult a doctor and take appropriate BP medication. And once you're diagnosed with hypertension and kidney disease, you'll have to follow certain dietary precautions as well. So one of the most important precaution is decrease the amount of salt in your diet. So decreasing the salt is very important because the sodium which is there in the common salt is responsible for a very high BPs, and that's the reason we have to decrease the amount of sodium in our diet. So sodium rich food like pickles or papads, namkeens, and lot of junk food will have lot of salt. So we'll have to avoid all this food to avoid taking high salt diet. Apart from this, you'll have to get used to decreasing the amount of salt in your curd or buttermilk, or for that matter any other food material you eat. So another thing is you have to increase the amount of fresh fruits in your food. So a healthy diet will always protect you against any kidney disease or heart ailments or stroke. So always try to eat plenty of fresh fruits, fresh juices. So these fresh fruits and juices will have high amounts of antioxidants, and these antioxidants will protect the blood vessels. So hypertension injures the blood vessels. That's the reason why we ask patients to take fruits. But if you are having kidney failure or advanced stage of kidney failure, only certain fruits are allowed. So in these patients, there is a restriction on the fruits part. Apart from this, maintain a healthy lifestyle. Go for exercise 30 minutes per day at least, 5 days a week. Exercise can be a simple walk or a simple cycling. You can go for a brisk walk at least for 30 minutes a day, or any other exercise where there is a movement of the body like swimming or cycling or cross training, treadmilling, trekking. So these are all several exercises which will help you in keeping your BP under control. And this also helps in CKD or kidney disease management. Apart from this, try to reduce your weight, have realistic goals, try to have targets, decrease at least 1 or 2 kilos per month or per 2 weeks. Then you'll attain your weight goals. So reduction of weight will definitely help you in reduction of hypertension. So friends, these are some of the aspects of high BP and kidney disease, and some of the management issues and precautions for patients with hypertension and kidney disease. Thank you.